Infancy, in particular, is the most explosive period of development in all of the human lifespan. So, for example, babies develop 1 million neural connections per second. Those neural connections develop the growing brain architecture. Brain architecture guides all aspects of human behavior, how we relate to each other, socially, emotionally, how we are able to pay attention in school and elsewhere, and our developing immune systems, so our long-term physical health. The Attachment and Biobehavioral Catch-Up, or ABC program, is a parenting program developed at the University of Delaware by Mary Dozier, so just up the road from us. It involves a trained parent coach going to the home of a baby and their principal caregivers. Other family members can be there too. 10 home-based sessions focus on supportive parenting behaviors that we know, based on research, child development research, support the developing attachment, the relationship of the baby to their caregiver. The ABC program really focuses on 3 types of supportive parenting behavior. The first has to do with being nurturing in response to distress in particular. So that means pick up the crying baby, comfort them. You can't spoil a baby, especially before the age of 12 or 18 months. In fact, we know from many decades of attachment research that the more babies are picked up and comforted when they are distressed, the more confident and less behaviorally dysregulated, or what someone might call spoiled or misbehaved, they become. We are hoping to see healthier weight. So babies don't have body mass index, but they have something called their weight to length ratio. And that can be, that can exist in different ranges in infants and toddlers, as I'm sure you've seen by observing any infants and toddlers you know. So we're trying to get their weight to length ratio, their developing body mass, in a healthy range. We're trying to support healthy sleep behaviors. And we think that in turn will translate into overall systemic health, fewer colds, fewer respiratory infections, fewer GI upsets or stomach bugs that kids easily pick up. We're trying to support their developing immune systems and reduce the possibility of systemic inflammation going forward. Some parents, without having had the benefit of the ABC program, might be instinctually inclined to offer something to eat or something to drink to a child who's very upset. And sometimes that's fair. You don't know quite what's going on with them, and that might be helpful. But we think if we can prioritize nurturance and reduce the reliance on what is called food to soothe, that is an example of how emotionally supportive parenting can protect children's developing weight, body mass, physical growth. When we visit mothers and their babies in the home, we leave them for 1 week with something that looks like a baby Fitbit. And it goes on the baby's ankle for about a week and comes back with all kinds of objective data that we can then download and analyze. So that is one example of the information that we're collecting. Pay now or pay more later. That is basically our basically we're following the principle of prevention. Or as Frederick Douglass famously said, it is easier to build strong children than to fix broken men. We are trying to build strong children.